In an effort to accelerate progress on reducing preventable maternal and child deaths, Nigeria has adopted a radical new approach to primary healthcare delivery through its Nigeria State Health Investment Project, Internship, a $170 million 5-year program that is supported by the World Bank and the Health Results Innovation Trust Fund, supported by the governments of Norway and the United Kingdom. Internship is an innovative financing mechanism for primary healthcare, which aims to finance results rather than input using a method known as performance-based financing, PBF. PBF is relatively new, and Nigeria is among the countries in Africa to adopt it, currently piloting it in the health sectors of Nasarawa, Adamawa, and Ondo States through the Internship.
The Internship project, which is the Nigerian State Health Investment Program, is a new approach to service delivery. The emphasis is on results, and what we've seen is that when you focus on results, performance, and then incentive are provided, you see triple-fold increment in terms of service delivery, and that is what we've seen in these 3 states.
In PBF, payment is not only tied to the delivery of pre-agreed health services, but it is also dependent on the achievement of approved standards of quality of care. This means that only after the claims have been verified and validated can payment be made, so it is very critical to the success of Internship that the verification process be transparent and of a very high standard. After 1 year of implementation in the first 3 local government areas, more PBF staff were needed to implement the Internship full scale-up in all 3 states. So a PBF internship program was designed to develop a critical mass of human resources with technical knowledge of PBF.
To implement a project of this scale, it's just in 3 states, but given the intensity of coaching and supervision that is required, we needed a whole different set of human resource that was not available. People who had training skills, people who had numerical skills, people who could write good reports, and people who could confidently teach others what they needed to know, and who could have an eye to look at issues and be able to provide the needed advice. Those are the kind of people that we wanted. And so that was what gave birth to the internship training program.
A master trainer conducted a 4-month-long internship program with interns who were selected through a series of tests and interviews.
The idea really is to develop an internship program that was really rigorous, so that at the end of the training, the verifiers would be well equipped to work on the field. So the one aspect was focused on in-class instruction. The second part was focused on the field training. On the field training was a great opportunity to really experience what it would feel like being a verifier. We really wanted them, the interns, discovering the information with their colleagues and sharing their ideas. And that's the way learning occurs. And at the end we saw, it was really successful.
After the training, the PBF internship graduates were employed as verifiers to monitor and ascertain the delivery of services claimed by the health facilities.
We visit all the health facilities at the beginning of a new month. The services they claim to have rendered for the previous month, they would have filled everything in. After you do that, you count what they have for the month, then you also record your own as the verified data.
Apart from receiving training on data verification and counter-verification, the interns were also trained to provide continuous coaching and mentoring to the health workers, guiding them on how to properly collate and analyze data, prepare their business plans, and invest their funds to deliver better results.
Da wannan bincike na wanda yake mana a karshen wata ana duba ayyukan da muka yi. In fact, abin ya taimaka mana sai because there's a lot of improvement. Inda sun duba bai daidai ba su ga mana this place bai daidai ba. And su kuma sun zama kamar abokananmu ne. They are friendly. There's no problem.
In this unique approach to financing, even the communities have a role to play in ensuring the continued success of the health facilities. Nigeria is the first country to implement a PBF internship program, and the effectiveness of these young interns is shaping the overall success of Internship. There is a common sense of belonging and ownership, and despite early challenges, the interns have now been accepted as partners in bringing positive reform to Nigeria's health sector and ensuring that these health facilities deliver better service.
I think it's fantastic we took that decision because we are beginning to reap, the profits. We are quickly trying to build a critical mass of Nigerians, who understand, the principles and the practice, of performance-based financing.
This pool of young entrepreneurial health workers have acted as verifiers for us. And what we found is that it will reduce the cost in the long run for this project. Because what we're also finding is that in addition to these 3 states that are implementing the project, quite a number of states are interested in implementing performance-based financing. So we envisage that this group of interns will serve as a pool to galvanize performance-based financing in other states that are interested outside of these 3 states.
More states in Nigeria are already showing interest in PBF, and what this means is that there will be a need for even more verifiers, which will in turn not just create more jobs for young people across the nation, but also ensure the success of Internship, thereby saving more lives.